Yeah. My pleasure to continue with you our second lecture in rehabilitation medicine. Just to remind you, for the first lecture, we discussed an introduction about and definitions of rehabilitation medicine, and we are discussing gait and its typical gait, with specialties which are very important, data for the patients, as we can evaluate or assess the patient before and after rehabilitation program. Our second lecture was discussing the aims of rehabilitation process. And these aims are: number one, prevention of complications of long bed rest. Each long bed rest, we must put in mind that the patient is immobilized. That means complications of immobilization. And the main thing which is well known maybe for you is bed sores, urinary tract infections, bone osteoporosis, and others. The first aim is prevention. Second aim is restoration of patient physical and mental health. Long bedridden, long getting out of social circumstances leads to loss of patient physical fitness, locomotor system fitness, and mental health. So the second important aim is restoration of these most important things. 3, providing aids and appliances. aids مساعدات وappliances مساعدات متطورة for resettlement at home, means arrangement for the crippled patient at home, and resettlement in work means we try to fulfillment what is the patient loss. Simple example, patient is completely healthy with physical fitness, physical activity, with good mind, and suddenly he become cerebrovascular accident, road traffic accident, motorcycle accident, cord compression. He lost his main job. So we try to find resettlement for his job and his work. How we achieve these aims, how we achieve these goals. We achieve these goals, these aims, by program facilities, rehabilitation program facilities. The rehabilitation services, that's the team which offer for the patient complaining of a stigma or insult, should start at the time of insult. Very important, this phrase. Rehabilitation services should start at the time of insult. I mean at the time of the accident, for the first hours, first day, second day, and there are many examples we can discuss later. In acute cases, hand by hand, 2 persons, hand by hand, means the rehabilitation team, rehabilitation man, physiotherapist man, must work with the medical or surgical treatment. Or even before surgery in elective cases, such as amputations, surgeries. The level of amputations, بتر الطرف, the level must be decided by the orthopedic surgeon and the rehabilitation man, which are very important for the next step, which is prosthetics. طرف صناعي, شكل الطرف, نوع الطرف, أنواع الأطراف. It is responsibility of rehabilitation. By chance, we have a very good a prosthetic workshop, very good prosthetic center، مركز أطراف صناعية موجود بالديوانية، كلش حلو، من الأجهزة والماشينز الألمانية، وب prosthetic technicians which are a very good grades and have a very good supplementation and facilities. Only depend on the materials if it's not available, so their job is delayed. Rehabilitation program should be adapted according to the patient's evaluation and needs. What are the facilities? First, nursing services dealing with very important. Nursing service means at the word of neuromedicine, at the word of orthopedic surgery, at the word of cardiac injuries. Nursing service must start from these places. First, proper patient posture to prevent contractures. Proper patient posture to prevent contractures. Turning and lifting to prevent pressure sores every 2 hours, as in spinal cord injuries or brain insults. 3. Care of bladder. Care of skin to prevent pressure sores. Supervision and supply of medications prescribed. All these steps I will discuss in the last lecture when I take an example, spinal cord injury or brain injury, and the patient with all these disabilities, and I will show you what is the main job of rehabilitation team and especially the nursing person. Occupational therapy. To ensure maximum independence and social reliability by provision and activity to restore full range of movement of the stiff joint, especially the hands, muscle power and coordination by specific work. Occupational therapy مهني عملي fine touch بالأصابع. The end result is independency in feeding, drinking, toilet, dressing, washing, cooking, cleaning. These are what's called activities of daily living, which I mentioned in the first lecture, ADL, and their levels, types. Then, supervision of for rooms, stairs, bathrooms, kitchen, passageways, and calipers, proper modifications. Occupational therapy. Vocational assessment and re-establishment of patients' work according to the disability. So, concentrate on the role of occupational therapy, important in a question and exam. Maximum independence, independence in activities of daily living, supervision of rooms, stairs, bathrooms, vocational assessment and re-establishment of patients' work according to their disabilities. Third person in the team is the social workers. What are their duties? To support and help patients to live with their limitations and encourage them for independent living, help the patient to face reality. Try to solve the patient's social and financial problems, cooperate with medical teams and local authorities. Medical team cooperation, solve social and financial problems, support to help them to live with their limitation and encourage them for independence living. It's a common problem for the patients with disability, cord, brain amputation, and he's always asking you about the sexual counseling, how you answer them. To deal with the sexual problems and offer advices, this is the responsibility of rehabilitation persons. Second, this depends on the site of the lesion and the end stage disability, whether related to hormonal changes or neurological deficits. This is the responsibility of urology, and always we consult a urologist or a male or female sexual deficit specialty. Sexual disability is always challenging a question for the rehabilitation man to offer an answer. Trials to induce artificial erection by using local injection of papaverine intracavernous injection are established partial successfulness in spinal cord injured patients. Sure, with this time there's many electric devices, many computerized programming devices which help the patients to solve this problem or to enjoy their life. The most important part in physiotherapy program is physiotherapy modalities. In the rehabilitation program is physiotherapy modalities, and this consists of the following. Number one is heat therapy. عندنا مستشفانا قسم بنفس المستشفى اللي هو قريب من إدارة المستشفى اسمه الفيزيوثيرابي والعلاج الطبيعي. The main part of this is physiotherapy modalities. It's not a rehabilitation center. The rehabilitation center is separated from the hospital. This is mainly physiotherapy modalities, relieve pain, relieve spasm of the persons. Heat therapy. It relieves musculoskeletal pain, possibly by acting as counter-irritant, vasodilator, and wash out of waste products. It proves to be useful alternative to analgesia. This is the rule of heat. Heat therapy either two types, superficial or deep. It's clear for you. Superficial means the penetration less, deep penetration أقل. I mean penetration under means only the skin or something like this millimeters, and the deep is 1 centimeter or more. Depends on the depth of penetration. Superficial heat facilities or modalities or instruments are infrared, emitted by electromagnetic wave, is the longer wavelength traveling in their air and absorb the skin up to 2 millimeter depth. Produce heat. Time of treatment session is 15 to 20 minutes, and the distance of the lamp from the skin 18 to 24 inch. Very important, these numbers. 2 millimeter is the penetration. 15 to 20 minutes is the time of the session treatment. The distance between the lamp, our system, our instrument, and the skin and the muscle, 18 to 24 inch. The second modality, or the second instrument, second tool, give us superficial heat is wax bath. It's very well known for the patients with joint contractures, very well for them. Consists of paraffin wax, melt at 45 to 50 degrees centigrade, used for hands, feet, useful in treatment of patients with rheumatoid, hand injuries, surgery, stiff hands, fingers, followed by active exercise. The third one is hot sponge. Fourth one is whirlpool. Clear, hot sponge means heat local. Whirlpool means water. Certain steel tank designed to contain hot water, accepted degree, currents of air under pressure to produce circular waves. So we get heat and massage effect. It's useful for relief of pain, spasm, and movements of the affected organ. Contrast bath is a very strange and important. We immerse, نغطس, the affected organ in hot water, about 40 hot water, 40 degree or less, for 5 minutes. Then in cold bath, 10 to 18 degree for 1 minute, 5 minutes hot, 1 minute cold, and repeat every half an hour. This is change heat degree leads to contraction and relaxation of blood vessels and vascularity state. The other type of heat is deep heat, which is more used than superficial. This is related mainly to deep spasm. Short wave produced by certain machine, which is able for deep heat production through rapid oscillation, 1 to 2 inch depth. Its penetration. Short wave. Microwave is more concentrated. Irradiation of tissue with deep heat production and much concentrated, used especially for small joints. There are contraindications for heat in general. Contraindications. It's very important for you. Muscle, skin, muscles around the joint. We want to prescribe heat. As a physiotherapist, we don't forget the following: infection, inflammation, thrombophlebitis, diabetic skin, infection, sepsis, acute inflammation, diabetic. This acute inflammation means like cellulitis or boils or something like this. These are the most important content for all types of heat therapy. The other physical modality is electrotherapy. Two types of currents, direct and indirect. Two types of currents, direct and indirect. The important one is the indirect one, which include galvanic current stimulation, Faraday current stimulation. Galvanic current stimulation, long duration continuous current. It stimulates the muscles directly, used in state of denervation, nerve cut, nerve death, nerve fibrosis, whether temporary or for long time. Like, we use galvanic just to give an stimulation to the muscles to keep them contracted and relaxes, to keep their contour, the muscle bulk, until re-innervation of the muscle will be achieved. Whether the other type is Faraday current stimulation, short wave current, short, sharp, stimulate the muscles through its nerves, not denervation, through its nerves, Faraday. Galvanic, denervation. It requires intact nerves. It is used in weakness of quadriceps, flat foot, and to regain muscle power after surgery. Very important to define the difference, to know the difference between galvanic and Faraday. Ultrasound waves, they are high frequency sound waves undetected by human ears. It's produced by high frequency. نفس الالتراساوند الموجود بالأشعة، نفس الالتراساوند موجود عند أطباء الأشعة وعند أطباء النسائية، بس our ultrasound waves is therapeutic. Their ultrasound instrument is diagnostic. They are high frequency sound undetected by human ears. Is produced by high frequency electrical current to crystal, leading to oscillation, and it conducted to human body by metal diaphragm. إذا تريد تشوفوه كلش مهم. هذول الفاسيلتيز موجودين عندنا بالقسم، بالمستشفى، يم الإدارة، يم المصاعد، قسم خاص للعلاج الطبيعي، وموجودة بالإنسترومنتس خصوصا خلال العملي. مع الأسف السنة، لكن مهم تشوفوا. What are the effects of ultrasound? Heating effect اللي هو deep one, mechanical effect and chemical effect inside the tissue. What are the indications of ultrasound? Acute strains and sprain, ligamentous inflammation, scarring after burns, crush injuries, fibrous following chronic edema, traumatic athletic injuries to reduce swelling and hematoma. Acute strain, sprain, ligamentous inflammation, scarring after burns, crushing injuries, fiber following chronic edema, traumatic athletic injuries to reduce swelling. Very important indication. The other most important physiotherapy modalities, which is well used in other countries in main rehabilitation centers, and it's well modified, different types, used very widely for the patients with different handicapped or different illnesses, is hydrotherapy. The use of water, especially the warm, in the treatment of a disease, either by total body or part of it to be immersed in water. The beneficial effects of water as media are warmth of water, buoyancy, floating water, hydrostatic and dynamic pressure of water, through that patient can perform all exercise while he was in water. Psychological and physical effect of hydrotherapy. The hydrotherapy have also indications and contraindications like the heat. The indications of hydrotherapy are muscle weakness due to nerve lesion, rehabilitation of amputation to strengthen muscles, following joints or ligamentous injuries, example mastectomy, following spinal cord injuries, paraplegia, quadriplegia, brain dysfunction, example cerebrovascular deficit like hemiplegia, rheumatoid ankylosing and OA. Contraindications of hydrotherapy are cardiac insufficiency, respiratory insufficiency, infected wounds, and incontinence. I hope these are useful for you practically and to know something very important as a part of rehabilitation medicine, and with my full thanks and thank you.